So I will be getting our webinar started. And once again, thank you so much to everybody who is here in attendance with us. My name is Dr. Erica, and I am from Team IMG Helping Hands. I have the pleasure of introducing two amazing individuals and today's webinar as well. So today we are going to be talking about the importance of research in your match application, how to start research as an IMG, and any other questions and doubts that you might have as well pertaining to research and the match process and the intersection of both. Also, we do have, like I said, two excellent hosts and guests with us. We do have our host today. We have Dr. Miriam Kananian. She is going to be today's webinar host. And our amazing guest, we have Dr. Fadi Ahmad. He is going to be telling us all about his research experience. And as always, we do encourage any questions that you all have, please add them in the chat. We're always eager to make this an interactive webinar and answer all of your questions throughout. So thank you once again, Dr. Fadi, for being here. Thank you, Dr. Miriam, for hosting this webinar. And the floor is yours.
Thank you. Hello, everyone. I'm Dr. Mariam, and I'm absolutely thrilled to be your host for what promises to be an incredible, insightful, and impactful session. So it's wonderful to see so many of you joining us from around the globe, all united by a common goal, navigating the highly competitive landscape of the match as international medical graduates. So today's topic, as Dr. Erica mentioned, is one that comes up frequently in discussions about straightening residency applications, the importance of research in match applications for international medical graduates. For many international medical graduates, demonstrating a commitment to research can be a game changer, but knowing how to approach it effectively can be a significant challenge too. So that's precisely why we are here today. We aim to shed light on why research is crucial, how to get involved, and how to leverage your research experiences to maximize your chances of a successful match. And to guide us through this vital discussion, we have an exceptional expert with us, Dr. Ahmed. We are truly honored to have you share your experience with us today. And please introduce yourself briefly.
Hi everyone. My name is Fadi, and of course, one of the reasons why I came here today in this meeting or this conversational meeting. I will make it more conversational. It's just for us to be united and talk about research. I think it's an important topic as an IMG, and also important for your future as a scientist, as a doctor, and somebody who wants to learn. So I have been involved in many research before, since I started as an undergrad. It's just whenever you get your hands on into research, like there is something in it. Like even though you want to leave it, there's always something that you want to go back to it, because sometimes it keeps you on your toes for your medical information, clinical advancements. So it's important to be able to know how to do research, because that's how we based our clinical management. This is how we based our prognosis. This is how we based the mortality rate. This is how we know about a new disease that emerge. This is how we know how to treat someone effectively. This is how they give us information about how to prevent a disease from happening from either vaccinations or anything. So being able to give something about research is a kind of a proactive way to show that you have interest in medicine, even though you already finished your medical degree in your country or anywhere in the US. It's important to be able to unite together in research, because putting your name out there can be so much meaningful. It's kind of like getting a degree. It's like an achievement. So I'm happy to be here and answer any questions during the presentation. But
Yeah, I do agree, Dr. Ahmad. It's very important to have research done during your years in the university. And after. So we would like to know more about you. What is your now specialty in medicine? And did you start to pursue your medical education in the USA or outside of it?
Yeah, so I have a kind of an interesting story. I grew up in South America, even though my name is not South American. I grew up in Venezuela, where I grew up speaking Spanish, Arabic at home. So I was never thinking of any chance in my life that I would come to the U.S. and be able to pursue my degree. I was not able to pursue my degree through a medical school in the US, but I was able to go to an IMG school in the Caribbean. And to be honest with you, I think it doesn't matter where you do your training. It's more about how you study during the process of medicine and how you approach and work with people. I think if you have the connections and if you work into making your application unique, that makes you stand out more. So, like that's pretty much a little bit about me in the sense of how I where I did my practice, like my education. And I finished my master's in public health. I finished my bachelor's. All that is important, but like everything that I was able to do during the process helped me to be where I'm at the moment. So like always be grateful for everything you learn through your journey in whatever degree you follow. But research is always something that you always must do in a way because it keeps you in your toes, you know, like that's something that I always advise anyone to go into that journey.
Okay, so at some point of time in your career, you also were an international medical graduate in the USA. So have you faced any difficulties as an IMG in the USA?
Of course, I mean, like we all have our own stories in a way. I think as an IMG, we all struggle in a way. We have to take the OET exam. We have to go through step one, a step two, a step three, and even we have to learn the language, which for some of you is like challenging, but it's not something that is not impossible. If you were able to get your medical degree and be able to achieve all of this stuff, I think it's like important to keep your head up and never like feel like you are behind in a way because it's just a journey. Like think of yourself that you're achieving another degree by just coming to a different country and being able to like do more than an US medical student, you know, like, or somebody who goes through that journey. I think experience is what makes you a better candidate in for nowadays, because now they look at the holistic application, you know. So being able to show that you went through challenges, you went through you came from a different country, you experienced a lot of hardships, and also you were able to learn the language. That to me sounds more as a like somebody who I wanted to be in my program, because they will be able to communicate with patients better. They're going to be able to kind of make a connection with patients. So I feel like your experience always talks about in your application. So I think that's something that you always have to keep in mind. Never give up if that's your dream.
Yes, I do agree with you. Erika, you wanted to say something?
Yes, yes, of course. And again, I'm pretty amazed by your journey, Dr. Fadi. I think it's amazing that, you both pursued medicine through the Caribbean, and essentially everything you said, rings true, that, there's more that you do as an international student, right? To prove yourself here in the United States, and just your involvement overall through school and beyond. But I think what my biggest curiosity at the moment is, going back a little bit, dialing back, possibly either at medical school or before that, was there any particular point in which you gained interest in research? Was there any particular experience that piqued your interest? How did your particular research journey start, if you don't mind me asking, Dr. Padi?
Yeah, so I mean, I as a student going through undergrad in the U.S., I had to struggle at the beginning, but of course they always tell you, oh, you have to do research, you have to find like advisement, good advisement, you have to work on volunteering, you have to do like like shadowing and things like that. So I said to myself, why not to start in a lab? And I said, why not to do bench work for free? Like I was not getting paid. I was just going 20 hours a week as an undergraduate, taking 18 credits per semester, and I didn't care. Of course, I have to work other jobs to pay for my tuition. I was lucky that I was also that I was receiving financial aid from my country and things like that to be able to pursue my undergraduate degree. But besides that, I was working in a lab for free, 20 hours a week, doing Alzheimer's research. So that's one of the my first work that I have done in research is much about bench work, immunochemistry, doing a lot of the procedures that are behind the scenes in a way to show like how to do like the slicing of the brain and how to like examine the brain slices on the microscope and be able to detect tau proteins in the mice brains and like things like that, things that like spark your interest in a way. But I feel like I was missing the human connection and the human research. I was working with animals, and I feel like it's important, and because we were able to now go to trials like second phase clinical trials after 9 years of working on a research, and it's not easy, like I had to work 20 hours a week for like almost like 2 years to be able to publish a paper with my mentor and be able to do it for free. But I was committing myself to do it because I wanted to learn. Like if you put yourself in the shoes of anyone, nobody starts getting paid by just doing something. Like you have to start for free, you have to work hard for it, and then the rewards come after. Like that's how I see it all the time. Even when we are medical students, we have to go through the process of like taking so much loans, spending so much money, and going through the process of having so much like debt that we get so like burn out in a way. But everything pays off. You have to work hard for it, and then everything comes true. But after I did my lab work, I decided that I wanted to do like more community-based research. So I started doing like a A1C, an A1C EMR, like a medical, like kind of uh, like uh, like improving adherence to medications by using the EMR and showing people like illustrations or education through promotores de salud, which are like community health workers that help you through your journey when you have diabetes. So I was recording data, patient satisfaction, and things like that. So it sparked my interest that by doing research, you can and community involvement, you can actually do both at the same time and show that data to databases and to like journal articles where they can see your work and they can see that you make a commitment to your community, because sometimes data can show more than words, and sometimes that's important. That's why I kept on going on research, and then I kept on joining like journal clubs and things like that, and then I started working in clinical trials. So I transitioned from community work to clinical trials because I was interested. And to me, clinical trials sounds like more clinical. You can be a doctor and a researcher at the same time. So I said, like, let me try it. So I joined a clinical trial called GRADE, which is a glycemic index for reduction, and it's like a big name of the clinical trial. But what we did in that clinical trial is we randomized four diabetes drugs that you most commonly see in the hospital, glargine, glipizide, sitagliptin, and liraglutide, which is a GLP-1 agonist. So you see all those drugs. We were actually randomizing. We were one of the big studies that a lot of people cite, because we were able to like randomize the drugs, see the outcomes, see what happens every 3 months following up these patients. To me, what that was fascinating. It's like I was following the patients every 3 months, like you would normally do in a as a doctor, right? Like as a primary care doctor, internal medicine doctor, and then you get data, and then you do like every 1 year we do the AKGs, microfilament, like the microfilament testing for sensory in their feet, and we did like a lot of procedures, and that also improve my medical skills. Like I was able now to be a diabetic expert, I guess a diabetes expert in a way, because now I can be able to know which drugs are better, which ones are better for weight loss, which ones will cause pancreatitis. Even though those are things that as you study medicine, you become more as an expert on how to decide based on the work you did and the research. But just to keep it simple and short, after I switched to clinical trials, I said, why not to do more like summary, do my own work, do case reports. I did some case reports, but I mean, case reports sometimes doesn't do much. But of course, as medical students and somebody who is in medicine, putting a case report can bring up more research, like big research. Like if I came up with an idea during my case report, somebody can get a spark and cite my work and say, oh, I'm going to start a review based on this paper. Like I can spark interest. And that's why research is beautiful that way, because you can just go so many ways with it. But I just want to keep it simple to give you a little bit of my journey of how I put all the pieces and why I like research in a way. But of course, like my ultimate goal is to provide care for my patients and do more connections with them. But being able to have the research experience keeps you at your toes and know what to do and how to manage them, you know?
Yeah,
Yeah.
definitely. And I
As you
think it's
have,
really, yeah, I think it's just really neat your overall involvement in research. And I really like the way you put it, where where being a physician and being a clinician, a clinical researcher are not two different items or two different things, but you can definitely be both in one. And I really like how throughout your journey you were complementing one with the other, where in you learning things in medical school helped you in your clinical research, and then aspects of your clinical research assisted you in your clinical care as a prospective physician during medical school. I think that's just an amazing way to really, bridge those two different worlds together. And I think just another question before I handed, excuse me, another question I had before I hand it back to Miriam was, how did you go about finding, the different research opportunities? Because I know you did clinical research, you did case, you did case reports, and I'm sure there are other types of research which I'm also eager to know about. Just all the different types of research that one could possibly do in medical school as well. But how did you go about finding yourself and your interest as you were navigating and those opportunities as well?
Yeah, I feel like the spark of getting to know more things is just is like amazing to me, because when I was doing my clinical rotations, I was like seeing like cases and people giving medications in a different way that is not really reported in research, but we still follow those protocols. We say, oh, we're going to give this medication to this patient, even though it's not FDA approved to give this medication to this patient in a way. And the reason why we go beyond like not using protocol is because we want to take care of our patients in the best way. And not everything is out there for treatment options or things like that. So whenever we find like a niche to like discuss a topic, and like a medication that you found that was interesting, or like even a supplement, anything that you find like interesting to talk about, that's how I like become more interested in like doing that research about. So like I did a global health elective where I went to Thailand, and I actually experienced myself. I've never been in Thailand, but I saw a lot of people in the community, they were using Yadum, which is like like just like a inhaler that you put in your nose and you start smelling it. And for them, it's like a treatment. It's like to treat sinusitis, to treat respiratory issues. But for them, that's like a healing home treatment that is actually approved by the FDA people in the government of Thailand. They use that as like an approval medication that you can keep at home. Like we use Advil for pain management sometimes, and that's an over the counter. They have that as an over the counter like kind of treatment, and I start and I started researching about it. I didn't see any work, any research done in using Yadum as a treatment option. So I started writing a review article about it, and I'm in the process of like trying to publish it myself alone. But I was just interested, like why not to put this work out there so other people know about this, and spark some interest to say, oh, like why not we do like some randomized control trials? Because I don't have the money or the time to like go through the randomized control trial studies. But like you can always get funding and grants, but it takes time when you are busy doing other stuff. So that's why you have to like be able to know your limitations of what is the research that you can do. So I said, why not to do a review and start from there? So I don't know, it's just my interest in research is not only into one subject or one direction. It's always about what sparks my interest and my motivation to keep pursuing that, if that makes sense.
Yeah, yeah. No, definitely, definitely. And that's kind of what that's kind of the reason I asked, because also for individuals watching, myself, or again, any of the viewers or anybody who's curious, just really, how your research journey can start, is, as always, starting can maybe sometimes be the most difficult step, or maybe since it is a new venture, a new avenue that you're pursuing, someone might not be as familiarized in how to go about starting, in this case, research. And so what I'm kind of getting an understanding here is that, you start by exploring your interests, and then in exploring those interests and becoming informed, you start, gaining that curiosity, right? What if this, or why this? And then just start reaching out to those involved in the respective research then, right? If somebody
Yeah.
was to start the research journey.
Yeah, I feel like that's the best approach of how you describe it. That's the way I always follow. Like that's my rule in life when I do research is I follow that. And I think it's I was not never an expert. So I had to like initially, like I mentioned, work for free, do this and get involved with mentors, just reaching out to people. Like if you find someone who's doing research about the heart and that sparks your interest, email them, like email them, say, I'm interested in your work. I like that you are working on congestive heart failure management treatments, and you're specifically now putting a new drug out there that I really want to research about too. And I'm interested too to work with you. Is there a possibility that you can get me involved, or I don't need to get paid or anything. I just want to get involved in the work. And that's how you start creating connections with someone to do some work. And I think it's and the nice thing about like being in as a like in the IMG Helping Hands is that you can actually be able to like participate with people and learn skills that you're never gonna learn in other places. Like you have to learn, like you will learn from research mentors. Of course, each research mentor has their own way of doing research, but you're gonna learn skills that you're gonna take for you for life that you can use. Like I mean, we went through a lot of things in order for us to be able to do this work, but then just by learning one skill that you get from just being in the program or being in any research involvement, that skill can take you far in life. You can use like just by knowing how to cite things, you can take only 1 hour to do citations, and instead of taking 2 weeks to do it manually. If you know the softwares, you know what to use things, like it doesn't take much, but like it's just knowing the right tools and the right things to use during your research journey can make it so much simple, so you don't have to suffer through it. Like and to say, oh, I don't have time, I'm not gonna do this, like it's too much commitment, like it's just possible if you know the right people and find the right connections. That's all you need.
Mhm, mhm. No,
Yeah,
definitely.
we do agree with you. Having the right people and right connections is very crucial. And as you have already mentioned, being an international medical graduate in the USA is it can be very tough for yourself and for your family as well, mentally and financially as well. So, Dr. Fadi, can you explain why your research experience is considered so important for applicants, and why it may be even more crucial for international medical graduates?
Yeah, so like the just to put it simple, I think having research is something that will make you unique for your application in any field in life, for your CV, for anything. But just think about it. You can be an IMG student and score 260 in your step 2, right? Like that's a nice score, right? But like imagine yourself, you're applying into a program that everybody has 260, right, in their scores, and they have the same CV as you, right? How are you going to be unique as compared to like to your colleagues? Like how are you going to shine? How are they going to see that you are much better? Like even if you have a 230, they're still going to filter you in to see your application, and then they say like, do I care if he got 260 or if he got 230? Do I care more about that, or do I care about what the work that he was doing during his process, his other holistic part of his application? Like, because nowadays, of course, the score can be a way to like get into the program you want, but at the end of the day, you may not get accepted even with the 260, right? Because they have to like know more about you as a person. They want this resident to be in their program, so they have to know like he's good with research, he's good with patients, he's good at socializing, he's good at conversational speaking. Like all those things are crucial to be able to like shine in your application. So putting research is a way to say that you are proactive at the work that you are doing, that you keep him learning about medicine, and that you show your commitment to medicine in a way when you do research. When you show them that you're doing research about a specific topic, you show them your interest, that you want to
Okay, so
continue. Yeah.
it is very important to have a natural interest in research, and we should not do the research just on the purpose of having our name in the scientific papers, but we have to be interested in it, right? And
Correct.
it is important not only for international medical graduates, but for everyone in the medical field, because it gives us certain skills which we can use later as clinicians, which can make our work better for everyone.
Yeah,
So
I feel like that's the best way of putting it. Like you just have to go through the process of shining and being unique, because sometimes me as an IMG, I always struggle to think, did I do enough? Did I did enough to really be out there, to people know that I have done the work, like the commitment. And whenever you do that work, you feel good about it too, like you are contributing to scientific information, and your name may be cited. Like some people can reach out to you and ask you about your expertise because you study that a specific area. It's like you being the expert in diabetes. You are researching on diabetes, and then your work gets cited, right? And somebody's gonna ask you, can you really talk to me about the process of how you went through the whole thing? Like that's something that is important, because you're going to show your skills during your research. You're going to show your interest in it, and they're going to really like that.
yeah. So it will help us to practice something known as evidence-based medicine, right? Which is a
Yes.
systematic approach to healthcare, which emphasizes the use of best available scientific evidence in making decisions about care of every individual patient. So I guess that's the reason why the residency programs, prefer applicants with previous research experiences.
Yeah, I agree, and I feel like it's just something that you have to like really think about it in a way that is going to make your application more holistic and more stronger. And at the same time, is I'm not saying that you should do research because you have to punish yourself and go through the process. It's just you have to do the research because you are interested in it, and also you love this part of medicine too. Because is they're gonna ask you questions about why you did that research. They're gonna ask you about why you wanted to do this and why you did this. You know, so you have to be prepared, and that's something beautiful because that also gives you beautiful time during your interview to discuss an interest, right? Because
Sure.
like not because if you don't have anything to talk about and during the interview, then they cannot ask you anything. They say, okay, he got 260, he is like super smart, but do I know anything else about him? Nothing. So having something put in your CV, your experiences that is unique, they're gonna ask you about it. Like they're gonna be like so intrigued about it that they're gonna ask you right away about it during your interview.
Okay, so as an international medical graduate without any previous experience in research, how can someone get involved in research projects in the USA? How where they should start from?
I mean, like there is always a lot of places you can start, but like for example, like being for example in this program, part of this program, the IMG Helping Hands, there's another a way to like kind of start research if you're not really new into like doing research, or you have never done it before, or maybe you have done it but you are still struggling to like do the research. So I feel like being able to connect with groups like this, and being able to have other students that can work together as a group during like a research project, it can add some value because you can learn from other students level of research, plus you can also learn from the research mentor. And sometimes by just joining a group, you can actually learn from them, and then by the time you are done with at least one research project that you work together, you will be able to maybe one day write your own paper, because now you know how to get through the skills and everything. So joining a group isn't doesn't have to look bad in any way. Like joining a group is actually something that we all need. I needed it to be able to be good in research. If not, I would not have never made it to research. Like it's impossible for me just to be alone and do research if I don't have the support from other groups or other people around me. So like never hesitate, never do research individually, because it's actually considered something bad when you publish too. Like they want you to be collaborative with other people and share skills and share ideas, because if they only see one individual writing the paper, they're going to say, oh, this guy only wants to show off, he just wants to show off his skills and say that this is the research he wants to do. But when you have so many people involved in one research project, it can show that you all work together for one common goal, and that's what we need in medicine too. So
As you have mentioned, doing research individually is not a good idea, and your results that you're getting in your research paper can be also considered biased if you're doing research individually on your own, right? Because there
yeah.
is no one to check the results that you got.
Correct. Yeah, like having other people's expertise in the field to check your work, like for grammar, structure, for citations, for like to analyze it in a way that you can actually get it not rejected on the first time. Like when you don't get a paper rejected on the first time, that's a good thing. That means that you did really hard work and that you work together as a group to make things. Because like imagine me doing a review paper and I had to create the images, the tables, the methodology, all that, when I can have a group of people and work together and then divide the sections, and then we all do a little bit of everything, and you can have your own time to do other things in life while you also do research at the same time, and we all compile a paper and work together through the whole process. That's beautiful, like that's something that we can all do together to make that process. And then you can move on to a different project right away. Like you quickly finish one and then finish the and come with the next one if you want to. But if you work alone, it's gonna take forever to finish your work, you know. And I feel like being in this type of group or environment is gonna give you like an advantage for sure, 100%.
Yes, I do agree with you. And at the same time, many IMGs worry about funding for research. But if you're doing the research with the group, then you don't have to take care of all the expenses, right? Because it will be divided between the group members. So in that case, it will be more convenient for everyone.
Correct. Yeah, I mean, research is expensive. Research is not
Very
also
expensive.
cheap. So, like,
Yeah,
just depending on the journal article, some journal articles you can uh, publish for free. Some journals articles they ask for $3,000, $4,000. I mean, of course, you can divide it among all of you, but like, if you can find ways to publish your work without paying, why not? You know, like I have done
sure.
that. Like I try to search work and say like, oh, let me search about this journal article. Oh, they have actually a diamond access. They have free access for me to post to put my work. I don't care if they are top five journal and top five and not top one. I don't care. I can still post my work and it's be a PubMed index for me to show up on PubMed, you know? People can just Google an information and you may come up as your name may come up when they search that specific search about your work, and your name can come up as a Google search and PubMed search, and people start citing your work. You know, like that's the beauty of research is that people start citing what you work hard for, and that's how it gets better. Like your work, your achievements, and also having research and having a profile of research can actually add so much value later in life as you become an attending or after becoming an attending. You can actually get positions that other people will not get when you have that research experience too. So like they will appreciate that more because you have unique skills that other people don't have. So just keep that in mind every single time that you do anything in life. Just keep in mind that you do it for a reason, not just because it's just there to shine or do better in life, but it's just for a reason, you know?
Okay, Dr. Fadi, is it important to have a single high impact research project done or multiple smaller projects? What will be more uh,
Yeah,
important?
so I feel like the importance of having so many research papers is not as important as having a one quality paper that really shows that your skills and you don't have any error, because imagine yourself working in five different papers. You sign up for five different papers and then you start scrambling around, you don't know what to do, and then you start doing this. You're gonna likely gonna get rejections. Then it's gonna take months to publish a work because you have to keep revising, you have to keep changing illustrations, you have to keep adding citations in a different way. You have to like, so it's just going to create more stress and more conflict in your work. So if you work in one paper and really publish it really beautifully, and then you manage it really well, then that will be more impactful in the process, you know, because you will create a quality paper instead of just like getting involved in so many papers. Of course you can always do it, but the purpose is to do at least a research, like just show that you are proactive. Yes, just showing that you are proactive and doing something during your application or during your studying time or during your job. It just show them that you have another skill to add or another importance in your application. But that's all you have to worry about. Don't try to do too much because it can also burn you out too.
Okay, yeah, that's very important. And I would like to know, is it important to present your research article in some conference? So, for instance, will the applicant who has done a case report and presented it in the conference have an advantage to an applicant who did a review or meta-analysis which was never presented in the conference? How does it affect your CV and your application process?
Well, like the beauty of having your work in a conference is that your name is gonna be out there. other researchers are going to see your work if it's the first time they see it, and you're more likely to get cited in your work if they see that it's something of other people's interest. So if I'm in a conference and presenting a poster, sometimes for some people it's like, oh, like I have to go through the pain to present my work and have a poster, stand there for hours, and nobody comes to my poster. It doesn't matter because your name is going to be there, you're going to be there, your poster is going to be there, somebody at least is going to read your work and is going to say, oh, like I'm going to continue following this work and I'm going to cite it and I'm going to use it on my next research paper. So it's an opportunity to connect. Like even when you are in the conference, you may find a program director that is going to say, oh, like I like this work, you may have a chance into getting into my program if you apply. Like it's just an opportunity to connect with other people and to like share your knowledge about your learning experience and research experience. Of course, it can be expensive, but there is multiple ways you can pay for it. Always find research experiences that you can do around your state or area. You don't have to travel that far. Also, or if you have the money and the commitment to travel and do a poster, just do it. Because it's also part of your application in ERAS. They have a section where you have to add your poster presentation. There is also sections where you have to add an oral presentation if you decide to do more oral than a poster. But like, just apply for any opportunity. And sometimes your school may be able to manage the funding, or if you tell them like, oh, I did this research, reach out to them and tell them like, see, I did this work. Were you able to handle a little bit of the funding on my behalf so that I can represent the school? Like that's something important too. Like um, for them and for you, because they will be able to fund your work. And actually, one of the things that I forgot to mention is that during my undergrad, I got so many scholarships to be able to travel and go to conferences because I got them for free. I reach out to this coordinator, to this person, and to be honest with you, I never paid for a conference in my life out of my pocket. I always find a way to somebody pay it for me, no matter how, but I will find a way. And it worked out for me. And it's not because I'm lucky, it's just because I reached out. If you don't reach out, you're never gonna get an opportunity in life.
That's true. Getting scholarships can boost our interest in doing research harder, and it can encourage us to continue to work. So that's a very important thing. And the next thing I wanted to ask is, does the research topic matter? So should it match to specialty that you're planning to apply? For instance, if I'm planning to apply for pediatric residency, should I have a research done on pediatric topic, or anything is fine?
I will say like tailoring your work into like something specific is important, because if you like, let's say you want to be you want to do internal medicine, for example, and then you want to do diabetes, like be an endocrinologist, you have to be able to show that you have interest in endocrinology. So you may wanted to do work around diabetes or thyroid issues or whatever you is your passion, like in that area of endocrinology. Of course, like any research is important, no matter what research you get involved. But like researching something that you are interested about and is closer to your specialty that you want to do in life is much important too, because you're showing that you want to work in that area when they see that research project. So, for
Mm.
example, if you really want to do uh, like something in pediatrics, find a research that really wants to talk about pediatric cases in the, like, I don't know, like what is the mortality rate on ICUs after the vaccine. I don't know, after giving the COVID vaccine. Like that's something that you can start like thinking about, like, oh, what is the topic that I want to do that is will spark my interest. And sometimes, like for example, in the IMG group, we provide a list of research projects every month. You don't have to follow that same month to do a research project, but we give you a list based on your interest, and you can pick, like, oh, I want to do this work because it matters more to me to do more about the heart, because I want to be a cardiologist. So do something that is related to the heart instead of like being able to like struggling to find something, and reach out. Like if you say that you want to do this type of work, tell them like, would you mind messaging me when you find a project that aligns with what I wanted to do, and then they will message you. Like they will keep your name and everything, and they will message you about the topic you want to do. So always reach out, and always be in the group and look out for that list of research projects.
Okay, so we should always get involved and take all the opportunities that are showing up.
Correct, yeah.
Yes. Okay, that's a great advice. And how should international medical graduates discuss their research during residency interviews? What kind of questions should they be prepared to answer, and how can they demonstrate their genuine interest and understanding?
Yeah, so would you mind mentioning the first part that you kind of cut off for me?
Oh, can you please repeat?
Oh yeah, can you please repeat the first part that you
Oh,
kind of
okay,
cut
okay,
off?
sure. The first part of the question was how should international medical graduates discuss their research during residency interviews? What kind of questions should they be prepared to answer, and how can they demonstrate their genuine interest and understanding?
Yeah, so for research, like for that, like during your interview process, like they may not ask you anything about your work because you have enough in during your experience. But if they ask you something about your work and your research, you have to be prepared to answer like the section that you mainly wrote about, like during the research process, or the but be able to be like good in general for the whole paper. So like for example, if you did the I don't know, like the methodology, you can explain the methodology because they ask you, what did you do in this project, well, what did you got involved into, and whatever you can explain, well, I was able to be part of the methodology section where I did it this way, and that way. But the main focus of the paper was this, and that, and this was the main finding that we got into the paper. So just be concrete, and be like, don't give too much information, because when you give too much information, they start thinking that, oh, maybe he's just making up stuff now. So like, just give something meaningful about the paper, something concrete, and then also like explain the section that you did the most in the research paper, so that they
Okay,
don't feel like,
so
oh, this guy just did a work and that's it.
okay, so we should just talk about key findings and introduce everything briefly when they ask us the question. So,
Yeah.
and what is one piece of essential advice you would give to every international medical graduate currently navigating the match process, especially concerning the role of research?
Yeah, so like the advice is like, start like opening eras, so, like start familiarizing yourself with what things that they're looking for, because you will be surprised. They actually have the section for peer reviews, non peer reviews, blogs, or whatever you have done in life. They actually want to know. Like, even though it seems like like not relevant to medicine, like anything that you do, some in a way they're asking you about it. They even let you put 10 experiences. So like, let's say you, even if you were not part of a research project and you were acknowledged in some work or something, mention that in the experiences. Let's say like, oh, I did this, I did that, I got involved in this, and this is my hobby, and even though I never got published, but I did research in this field. Like, you can always say that. Like, it's not everybody can get the opportunity to be published, but doesn't mean that because you're not an author, you never did research. That doesn't mean anything. So you have to show your skills in a way, and that's why you have the 10 experiences where you can show that. You can say, oh, I was involved in a research article, I was involved in a research group where I did this, and I did data extraction, and I was acknowledged for that data extraction, but I was never part of the being an author of the paper. So just showing that skill is not going to hurt you. So you have to be able to prepare yourself for what is on the ERAS, but mainly adding these experiences will make you be unique. So
Okay, so they're taking into consideration each and every experience that we had in a research field, even though some of them may not get published, but they are important still.
Yeah, of course.
Okay, thank you very much. Dr. Erica, do you have anything to add?
Of course, of course. Yes. Thank you so much, Dr. Miriam. And, I think before going into the questions that we have here in the chat, again, I did just want to thank once again Dr. Fadi for just really providing such excellent insight, really navigating through, showing us your journey throughout your research experience, just essentially where it all started, where you're at right now, how one can go about finding themselves in research. And I think, just that journey is amazing and definitely one that people can emulate. Likewise, I do also want to thank Dr. Miriam for just asking very insightful questions as well, because there were definitely some questions that I had in mind where I was really eager to know, and I did want to add, and why didn't I think of that? Why didn't I, think of this question that Dr. Miriam is, inquiring? So I really do commend you both, and I really do appreciate all the information that you've shared with us so far, both Dr. Miriam and Dr. Fadi. I did just want to, again, check here in the chat and just again, as Dr. Fadi mentioned, something amazing about IMG Helping Hands, as you said, is just really the the multiple benefits that you can get from it. As you mentioned, starting research, getting your research journey started. If it is your first research experience, it's definitely an ideal avenue that one can take. The networking aspect as well, getting to work with other people. And the best part is that we do publish. So, even if I know Dr. Fadi mentioned in the instance that you don't publish, you can still definitely mention in your CV your contributions to the prospective manuscript. I think it's just amazing as well. I'm seeing here again, Gajanan mentions, that he's a third year medical student. He's a third year student with no publications. Is it okay to start meta-analysis? And is it a good avenue to pursue?
Yeah, I mean, it doesn't matter what type of research you do. A lot of medical students are always told to like do a case report at least, or do two case reports or whatever, which is more of an easier research. But when you show that you're doing a meta-analysis, that tells you that you did more work than a case report. So I will say doing a meta-analysis is actually going to help you more than hurt you in a way. So I don't feel like doing a meta-analysis study is gonna be like less of important. Like nobody can be a woman in sometimes in a randomized control trial because they are expensive and they need grant, they need funding, they need money, and most of the big institutions are the only ones who are able to afford that type of work. So just by doing a meta analysis and or a narrative review, that's more than enough actually to show in your application.
No, definitely. And just to recap as well, again, I know you mentioned your extensive research experience. For somebody who is speaking on their research, do you recommend, again, this is a question by Isaac, do you recommend that somebody speaks on their research experience in their eras or in their personal statement or both? What do you think, Dr. Fidi?
I mean, if the research experience is something that is going to contribute to the specialty you're going to, and you don't have like another story to say about yourself on the personal statement, then I will say that you should include a little bit of it. But I will say that leave that research experience in the peer review section. If you show that you are published, they don't need to know more about the work, right? They will ask you about it during the interview. You don't use your personal statement to write about to tell about your research as much, but let's say if you don't have a story or something that really is different from the your whole application, then don't invest that energy in putting research in the personal statement. And that's just my personal opinion. I think you should talk about your story, like your challenges. When you came to this country, I did this, I did that, like something different that is not part of your sections that you will add, because you will have a section where you can add your research work. And if you don't have experiences enough, then you can use one of those slots to put your research experience. So that's just my personal opinion. I think you should focus on keeping your personal statement about something about that is unique about yourself that nobody else has, and show that, like be positive about it and show it, you know.
No,
And in
definitely,
case if,
definitely.
I'm sorry, in case if someone had no opportunity to do any sort of research project during their university years, is it too late to start after graduation, or is it okay? Does it matter or
No,
not?
no, no, it's not too late. I mean, that shows your commitment that you did something after, even after graduating. So it doesn't matter when you do the work, because I have done some work during my undergrad. I did some work during my graduate time, and it doesn't matter. Like, it's just showing your commitment. Think about it this way: instead of like applying to the match, you apply to the match, and you're waiting for a year to know where you're gonna match. In that year, you can say, I'm under the process of working on this paper. Like, you're showing them that you are proactive at learning something during your match time, or during your you finish with an MD degree. Like, you keep on going. Like, we all have different circumstances. I remember having a friend of mine that she was a mom. She had two kids, and she got into medical school. She finished medical school in a different country. She came to the U.S. and she wanted to like pursue medicine, and she was not able to. But after 5 years of taking a step one, a step two, failing, and going through the whole process, she was doing some research work in the process too, and that actually is what got her into medical school, because she was proactive. Like, I mean, into residency, not because she failed exams or she did that. It's just that she showed resilience, and she showed that she wanted to be in medicine, even though she was already a mom. So imagine, that's a story she can tell. Like, being a mother, I have two kids. I still want to go into medical school. I still went to the process of taking step one and step two, and I went to medical school. Like, that's amazing. Like, for a mother to do that when she has two kids and she finished her degree, and now she has to take all these exams again. Like, that's a story you can say in your personal statement. And the and the research is just something separate that you're gonna discuss. But I will say, like, anytime is okay. It's just an experience, you know.
Okay, sure. We don't have to give up on our dreams, no matter how hard circumstances are, and we should keep trying to reach our goals. Um, yeah, and in the process, if we have any gap years, we can fill those years in with doing research, and it will be very awesome in the process of application as well. Thank you.
And let me see. So I am seeing another question here, another good question here from Ari. If you don't mind, Dr. Fadi, they are asking us if research is important for all specialties, or do you think research is required for competitive residencies such as germ or so forth? Again, do you think it particularly benefits certain specialties? Do you think anybody with an
um
interest should pursue it?
I mean, to be honest with you, I think it's all depends on what you wanted to do and what program you want to go, and of course a specialty. But like, let's say you want to do family medicine and you still are interested in research. I don't see that doing research is going to hurt you in your application for family medicine, for example. But let's say you want to apply for surgery, or you want to apply for dermatology, or you want to apply to a more like a heart specialty, like anesthesia or radiology. I mean, you have to show the work, and the reason why is because there is not enough spots, as compared to other specialties. So you have to be able to be unique, and having the research is going to give you the advantage that anybody else will not have during the application. Like, and to be honest with you, I think, like, for example, in surgery, people who show research, they have a higher chance of like getting accepted, because like, they always say, like, if you want to become a surgeon, you have to be able to be good at everything. And that's just a saying that I hear from every single attending or every single doctor I see that is in surgery. Like you have to be good at like doing research. You have to be good at like dissecting the patient from head to toe. Like you have to be good at everything. You know, like that's what they say. But it's just like these are attendings and people that always look at patients, always look at data, always look at papers, and always look at like what is the worst and the best outcome. So of course they need research. So like if you want to really apply for like surgery, for example, or anesthesia or radiology or dermatology, you really need to show some work because that will make you more unique. And but of course, research is important in every single specialty. No matter what you specialty you do, it's gonna make you unique. Like let's say I want to apply for the top family medicine program in the nation, and I show them that I did research. Then that gives you an advantage to actually get accepted there, just because of the research. It doesn't matter. So like adding that adds value too.
Mhm. Wow. No, and I really do appreciate again your insight on that once again, Dr. Fadi. Again, I feel like this has been a very insightful webinar regarding the overall pursuits of research. I am seeing here again just individuals who are interested in getting involved and getting started. How can we go about co-authoring and so forth. And so I did just want to remind everybody as well. I did provide here some information whether you want to join the research community. As Dr. Fadi mentioned, there we will be sharing monthly research topics that you can definitely take part in. And again, all of these topics definitely do publish at the end of, just upon completion. They do publish, so you can definitely become involved, as Dr. Fadi mentioned, in a very, amazing teamwork, team-like environment. Likewise, with individuals who are asking, a little more specific questions or more personalized questions here in the chat. Once again, I do appreciate everybody who is providing their questions, and all of your inquiries are always welcome. If there's something a little more specific that you want to ask related to your particular journey, I did also add the link as well to schedule a consult, do the consultation with MD, likewise, contact information and so forth. And if, outside of research, is something that you're interested in as well, again, I do want to remind everybody about the opportunities. You can definitely do narrative reviews, meta-analysis, as Dr. Fadi mentioned, which is definitely a strength when it comes to applications. We are currently in the process of working with individuals doing CDC research, CDC Wonder research, so that they can present in a conference as well. So, we're very much proactive when it comes to, connecting individuals with the opportunity. An excellent first step, as Dr. Fadi mentioned, just overall being proactive as well. And if for any reason, again, outside of research is something that you're interested in, maybe you're already in the ARIS process, maybe you're already looking into the application itself, we do have additional assistance there too, where we can, just equip you and help you present yourself as best as possible. And so with that in mind, I do want to thank Dr. Fadi once again for his time. Thank you so much, Dr. Fadi, for all of the guidance you offered us. And thank you so much, Dr. Miriam, as well, for all of your excellent questions and everybody present too.
Thank
No,
you.
I thank you so much for the opportunity, and I hope that you reach out. If you have any questions, I believe they put their information on the chat. So just make sure that you click on those links, schedule a consult, like try to like be proactive, like as Dr. Erica mentioned, because I feel like it's important to do the work for you to be able to succeed. So I appreciate Dr. Miriam and Dr. Erica for having me, and I hope you guys have a nice day.
Thank you so
Thank you
much. And
very
thank
much.
you so much. All right. Well, thank you so much once again, everybody. This does conclude today's webinar. Again, thank you, Dr. Fadi. Thank you so much, Dr. Miriam. And thank you to everybody who has been here present, providing amazing questions. And as always, thank you so much. And don't forget to stay connected. We'll see you in the next one.